Many Americans suffer from chronic back pain. Disc replacement surgery may be an alternative for some of them. We visited Tri-City Regional Medical Center in Hawaiian Gardens to find out more about the procedure.
The procedure that we're going to be discussing is called artificial disc replacement, or more technically known as disc arthroplasty.
My life was very limited. Back pain all the time, standing up, laying down, sitting down. I was always up, down, up, down, up, down. It never really went away. It was always hurt. I'm thinking probably 15 years, maybe more, of just progressively worse and worse and worse.
Back pain is considered a very complex and challenging issue for most physicians and other healthcare providers who treat people with back pain. There are many different causes and etiologies for back pain. Some of the causes may include fractures, injuries that result from a trauma. But the more common cause in the United States is usually from chronic degeneration that happens to people.
I went through every treatment numerous times and no one can ever do anything.
As time goes by, as we age, as our spine ages, the discs that are usually hydrated, the disc starts to dry out. There's a lot of complex chemical reactions that actually take place in the disc space. And as time goes by, the disc height starts to get smaller and smaller, where at a very severe point, the disc almost completely degenerates, and you get a phenomenon known as bone-on-bone phenomenon.
I had been through many physical therapies, stretching, working out, make sure you watch your weight, watch your diet. At the final part, I had epidurals. I think I had like maybe 12.
Once these patients have exhausted all these non-surgical treatment regimens, then they would be referred to someone such as myself, where we would then carefully evaluate them based on their clinical exam, their history, their MRI, and possible CT findings. And once that is done and we feel that someone is a potential candidate, we may then decide to have them receive other types of diagnostic procedures that would tell us whether they would be a good candidate for this procedure or not.
I had a discogram done, which pinpointed exactly what it is, and the doctor said that they have a new product out, which is going to be an artificial disc, which is going to replace my damaged disc.
This procedure is not meant, or unfortunately cannot really help every patient. Patients have to be very carefully selected to see if they have the correct set of parameters that would actually result in a good outcome.
As soon as the surgery is over, he says you should be close to 100%.
Once we are certain that we are at the correct level of the spine, where we intend to do the operation, we will start to remove the disc material from the area where the disc has degenerated. Once that is done, as you can see here, the artificial disc is implanted in a multi-step fashion. The patient's body and spine will actually grow bone around the artificial disc, and the artificial disc becomes incorporated into the patient's spine for long term.
When I woke up, I felt amazing. No pain. Never felt better in my life. And from then on was just living life. Go play with my child. I could go play with my girl. Go water skiing with my family. It was night and day. It was just amazing, the difference in what it was and to what it is.
It really is great to have a world-class healthcare facility right here in our small city. And we wish Robert a happy and active lifestyle.